A lot of people have to go on Medi-Cal. A lot of people have to get insurance through the government. You're a healthcare company. You should be able to do something.
You own Aetna, you own Caremark. There's no way you can't tell me you cannot find a way to come up with a package for your employees.
CVS owns one of the largest health insurance companies in the country. But 64% of CVS workers in California don't have employer health insurance, according to a survey by their union local, the UFCW 770.
It's crazy enough that we're underpaid, but now you have to put a large portion of your pay towards your health care, where people now all of a sudden they have to decide, do I want to have health care or do I want to put food on my kids' table?
Okay, so here we have CVS. You got to question their commitment to the health of their clients if they can't figure out a way to adequately ensure the health of their employees, right? You would think that with Aetna/CVS being a major health insurer and also healthcare provider, that this would be a no-brainer for them, but it is part of a much larger issue that we're going to discuss. And listen, to the extent that these premiums and costs keep skyrocketing, which is what they're doing, that means you got less of an opportunity to control your own destiny by purchasing assets. Money is flowing out of your pocket, not just for the premiums, but for the co-pays, for the treatments. And then we have companies like United Healthcare, which has the highest rate of denials, claim denials in the country. So it's almost like in some cases you don't even have insurance. You have the privilege of paying premiums for nothing. We're going to talk about how we can solve this problem. We need to put more money back into our pockets and take more control of this situation. And there are two different ways, one legislative, one all in our control right now, that we can do that. We're going to talk about that.
CVS workers in Southern California went on strike on October 17th. After 6 months of negotiations, the union and CVS have
mind you, this is 2024.
Reached a tentative agreement that would address many of the issues we heard about from workers. But CVS employees all across the country will continue to experience these issues and worse.
CVS has gotten cheaper and cheaper. All they've been interested in is just keeping their profits.
CVS made $8 billion in profit in 2023, yet many of its workers are on public assistance.
Come on now. Listen, I'm the ultimate capitalist, and capitalism is one way we can solve this healthcare cost problem. We'll get to it in a minute. Stay tuned, okay? This is very important. I want you to share this video. Definitely hit that thumbs up. We need to let people know what's going on here, and we need to let people know how to solve it. So I'm the ultimate capitalist, but look, to the extent that you've got employees, they are an integral part of this equation, because ostensibly without them, then how are you going to make this money, right? There are three important groups in this equation. They are the employees, the clients, the shareholders, okay? And you've got to make sure that each of them is treated equitably. And if one group isn't, then you have to question the commitment of the company to the other two groups.
Of the many issues at play, none is more painful or ironic than the unaffordable employee health insurance plan offered by CVS, the second biggest healthcare company in the world.
Do I have insurance through CVS? No, I don't. I have it through government assistance, which is Medi-Cal.
So CVS, what they're doing is they've got these plans that their employees can't afford. So basically what CVS is doing is they're pawning off the responsibility to the U.S. taxpayer in the form of Medi-Cal, which is, in this case, Medi-Cal, because they're in California, which is the Medicaid option out there.
It sucks because it's basically, there's times when I know I'm sick and I know I need the medication, or I have an issue, I have a pain or something, that I can go to the doctor and I can have that remedy fixed easily. But I can't do it because guess what? I don't have health insurance. Going to urgent care is going to cost me a couple $100s. Getting the medication is that's going to add on to the price.
The company has two separate and unequal health insurance plans. a more affordable plan for A stores and a more expensive plan for B stores. What's the difference? Nothing really. Workers at stores CVS bought in 2007 to 8 are A stores. The ones that came later are the B stores. That's it.
We even asked them about it. It's like, can we, get the healthcare into one healthcare? And their response was no, it's not reasonable. It can't happen.
Part of the problem workers face is CVS's dominance of the pharmacy market, which gives it power to push poverty wages, skeleton staffing, and unsafe conditions at retail pharmacy stores. Even as it closes stores itself, its sheer size allows it to dominate.
It's not about what's best for the community. It's not about what's best for the workers. It's about cornering the market. It's basically killing competition.
Okay, and again, I have no problem with a company going out there and making money. Furthermore, I will also admit that our healthcare is our responsibility. However, it looks as though our responsibility is getting curtailed by fewer and fewer affordable options to obtain the healthcare that we're responsible for. I've encountered medications in the course of my work that people are paying, $37,000 for. All right. Now, look, there's a whole lot of research and development and patents and all that goes into it. But when it comes to healthcare and capitalism, and you weigh in and you let me know, where does morality come into play? Does it? All right. There has to be some incentive here financially. Otherwise, people would not create these medications. Okay. We understand that. They wouldn't create these treatments if there were no financial incentive in it. It's a tough question I don't have the answer to, but I do have the answer to how we make healthcare more affordable for ourselves today. Okay. So we're going to look at what we can do, and then we're going to look at what we need to demand the government do immediately. First of all, look, an HSA, you may be qualified to open an HSA or health savings account. Now, I'm not going to go into the details here, but I have gone into the details here on this video that I want you to watch that we produced quite some time ago. So understand that an HSA can help you save in 3 very important ways. Help you save on healthcare. And there's some other incentives to the HSA that can actually help you grow wealth while making your healthcare cost more affordable. And understand that healthcare costs in this country are so high that healthcare is the number one driver of bankruptcy. Those bills account for 60% of why people go into bankruptcy in this country. So if that's not telling you something needs to be done, I don't know what will. All right. So look at that video and learn more about the HSA. Make sure you do that. Make sure you share that video as well. The other thing that may be counterintuitive, but very, very effective. When you go to get a treatment, ask them, what is the cash price for this treatment? I know that sounds like, well, I've got insurance. Why would I pay? There's a lot of red tape once you invoke insurance. In every hand that touches anything dealing with your medical billing, the procedures you've had, drives up the cost. So if you merely ask, if I were to pay for this out of pocket, you may find, and in a lot of cases, you will definitely find that the cash price is significantly lower. Why? Because it goes through less red tape. Okay. When you say, I'm going to pay in cash. Look, studies have shown that you can find discounts of anywhere between 30 and 70% if you're going to pay in cash. That is tremendous. And you have to do the math to figure out whether or not that 30 to 70% discount is affordable, makes sense when you take into account co-pays and premiums and that sort of thing. All right. In addition and additionally, a lot of times when you offer to pay cash, you can also set up a payment plan. All right. And the magic question you always want to ask when anybody offers you a payment plan is, at what interest rate? Because you're going to have to factor that in as well. Okay. So getting a payment plan, negotiating your medical bills. It's just like anything else, right? If these companies are not going to offer you a fixed price list, like when you go into 7-Eleven or to a restaurant and it says this is the price, if they're not going to offer you that, then that means the services are negotiable and you should definitely negotiate those services. Another valuable tip, if it's a genuine like emergency, I had to get my hand stitched up, I had a lawn and gardening accident a while back, that is something that you could probably get taken care of for a lot less at urgent care as opposed to an emergency room. And it's also going to save you in another way, quite potentially, your valuable time. All right. So ER visits typically cost anywhere between $1,500 and $5,000 a pop, where depending on the situation, urgent care is between $100 and $300 a pop. Okay. And if it's a issue that maybe you got a cough or something, you can use telehealth, then you're going to bring it down even further to between $30 and $50 a pop. Okay. So those are some ways to uh, decrease those health costs that we can start using right now, today. Now, what do we need the government? Okay. What do we need them to do? What must we demand of these policymakers and politicians?
85% of Americans say that they have had delays in healthcare because of prior authorization. And the doctors hate it. Doctors report that it costs them 12 to 15 hours a week filling out forms. Some nurses are spending over half their time dealing with the administrative burden of this. And healthcare is often delayed to Americans. The cost of administration is enormous to our healthcare system, and we're going to be able to eliminate a lot of those costs.
All right. So that was RFK, the Health and Human Services Secretary, talking about a phenomenon in the industry known as prior authorization. Now, there's a big debate in the country about phasing prior authorization out. What is it? That's simply when you come in. Let's take an extreme case. You come in with a compound fractured wrist, right? Visible, but you need prior authorization from the insurance company to see the orthopedist. Now, I'm not suggesting that anything that extreme actually exists. I just wanted to illustrate for effect. When you have people who are not healthcare professionals, and I'm talking nurses, doctors, nurse practitioners, physicians, assistants, when you have people other than those professions opining on when you should be able to see a specialist, that drives up cost. All right. You should be able to go and see a specialist without getting some sort of authorization from an insurance company. All right. They already have it such that your copay for a specialist is usually more than it is to see your primary care physician. So that's already built in. Why do we need some paper pusher, some white collar office worker without a medical degree telling someone when they can see a specialist? This drives up costs because there's more administration. It creates delays, which also drive up costs simply because your situation could be exacerbating while you're waiting for this magical prior authorization. Another thing that so policymakers need to abolish prior authorization. It does not make medical sense. It might make business sense, but this is a unique business. We're dealing with people's health and their lives. The next thing we need to do is we need to demand price transparency. I spoke about it earlier. Why is it that I can walk into a gas station mini mart, a restaurant, a bookstore, a liquor store, any number of retail or wholesale locations, and there is a price clearly visible? I know what I'm spending before I purchase it. Why does this not exist in every emergency room, in every urgent care, in every hospital across the fruited plain? Why is it that I don't know how much I'm paying? And when I don't know how much I'm paying, it creates an opportunity for the healthcare industry to inflate cost. It also reduces competition. It shields monopolistic practices when you don't know how much you're paying. So why don't we have unbridled competition and publish a price list? We need our policymakers to demand full and complete price transparency. Next, and again, unbridled, full frontal capitalism. We need these insurance companies competing across state lines. We need interstate competition in the health insurance landscape because, in that way, it drives them to create efficiencies, to remove administration, and they're in a situation now where here in Maryland, you pretty much have a duopoly between Blue Cross and Kaiser. In many states, you find that. But why can't I get a good healthcare plan from some company in Texas, right? Now, of course, the industry will give you all kinds of excuses. But if they want to play in a capitalist environment, then they should have to play with unbridled competition. Look what competition has done with regard to the telecommunications industry. It used to be you had one choice, AT&T. Then after that, you had AT&T and T, and you had Verizon and you had uh, Comcast and all kinds of other companies come in to the point where if you're old enough, you remember long distance. I used to charge you to call down the road a piece, right? Now you can call anywhere you want to in the United States of America, and there's no such thing as long distance essentially anymore. So there's more choice in the market, and it's much more affordable. Why can't we have the same be true for healthcare? And any company claiming that they can't do this, then they probably need to be out of the business because it just proves they're not thinking in an innovative way and they're not thinking in a manner that best suits the welfare of their clients. So, those are some things we can do right now to lower our healthcare costs. More to come.